it's a helpless feeling because, all I was getting all these phone calls and there's nothing I can do. And I haven't even talked to Lynn since she's been diagnosed. The real sad and the tragedy in this for Lynn is just knowing that she doesn't understand what's happening to her.
As the world grinds to a halt in efforts to prevent the spread of the deadly coronavirus, my newspaper set out to discover how it's upending lives across the region. I wanted to find out how all of you were feeling and how you were coping. And I wanted to do it all without ever having to come into contact with you, as a way to help prevent the spread of the virus. Here's what I came up with: the COVID-Diaries. It's a series of interviews, all conducted over video chat, that take the temperature of a community in a time of dramatic upheaval.
Okay, so, you and I have talked a couple times before. You and I actually started talking right when this crisis really started unfolding. We talked about your wife, Lynn, who's in a memory care facility, and she has Alzheimer's. And you sent me a pretty sad update today. Can you tell me a bit about what's going on?
Yeah, as of about 2 a.m. on Wednesday, she's been diagnosed with COVID-19. Fortunately, she's only got mild symptoms, and they weren't the symptoms that everybody associates with COVID-19. She didn't have shortness of breath or trouble breathing or anything, but she did have she was congested, which I noticed on Sunday night. And Monday rolled around and I mentioned it to the staff, who also noticed it. And they've been taking the residents' temperatures about every shift change for the nurses. So Tuesday morning, she was fine. And by Tuesday, second shift, she had a fever of over 100 degrees. So it was a little bit harder process than I expected. I don't know why I thought they could do the testing at the facility, but they had to send her to a hospital. And that took a while. So by the time she got to the hospital and they got the non-emergency ambulance to take her to the hospital, which was around midnight, 1 a.m. on Wednesday. And then about 3 o'clock in the morning on Wednesday is when I got the notification that she has COVID-19. So good news is she's back at her facility, which is familiar to her. She's in an isolation wing. They've got one other positive that I'm aware of. It's actually really Lynn's closest friend there, which I guess is maybe not too surprising. But I don't know all the details, and I don't want to speak for the facility, but I know the county, San Diego County, is involved. And I see your cat in the background. You may see mine here too. So so the county's going to be doing testing of the staff and the residents just to see where they stand with everything. So that's where we are now. I mean, it's hard. Yeah, it's a helpless feeling because, all I was getting all these phone calls and there's nothing I can do. And I haven't even talked to Lynn since she's been diagnosed.
Was this a developing concern for you as time went on? We haven't talked in a while. Have you been worrying that this might be coming?
No, not really. I thought if anything would happen, I'd be the one who got sick, not her. I was trying to think how that would play out if that happened, but I'm fine. So, no, the last time we talked, I was concerned about her level of anxiety increasing, and that has continued to increase. We tried video chats a few times, but those were partially successful, I think. The last one we did, she didn't know who I was, which is not alarming. I mean, there were times we were together, she didn't know who I was either, but they were just kind of hard. The phone calls were fine most of the time, just repeating, well, repetitive as you might expect with somebody with dementia. And she kept asking when I was coming home. And this was the hard part, is I just kept telling her, I'll be home this afternoon. I know it's the right thing to tell her just to go with what she presents, but it just gets hard to keep lying to her all the time. But it's better than telling her, I don't know when I'm going to see you again. Like we talked about from the beginning, I have to be in her world, in her moment.
And is she able to understand? We had talked a bit about this before, right? That you don't really explain to her there's this worldwide pandemic. That's why I can't come see you. Does she have a good sense of the fact that she has COVID-19 or what that could mean?
Yeah, I don't know, because I haven't talked to her yet. So that's a good question. I need to ask the staff. I doubt it. for me, that's the hardest part of this. You know, she gets rousted out of bed at midnight on Wednesday, put in an ambulance with nobody she knows, taken to a hospital where everybody's got full PPE. They're doing tests on her. You know, that's the hard part for me, is the helpless feeling of not being able to be there for her, and what's going through her mind at that point. I guess the saving grace is that she probably doesn't remember any of that even happened, which is good. So I don't know. It's just hard.
We've talked about this every time we've talked, but you expressed the first time this fear that that when you couldn't be there to see her, that she eventually would come to the conclusion that you didn't love her anymore. Where do you think that stands?
Yeah, that's tough. Because in my, you know, my less than steely moments, you know, I don't want the last time I saw Lynn to be the last time I saw Lynn, if that comment makes sense. So, which was March 13th, and I don't know if I would have done anything. Well, I don't know. It's that, and I don't think that's going to happen. But you know, when you get a phone call at 3:00 in the morning that your wife has a terminal or a potentially terminal disease on top of another terminal disease she already has, those are the kind of thoughts that enter your mind.